What's up, you guys? This is Boy Miguel giving you your daily dose of radiation. In today's video, we are covering how much do we deal with law enforcement as an X-ray tech in the ER hospital. So, to give you some context, I am an X-ray tech, work night shift mainly, 7 on, 7 off, and I dabble in day shift a lot because I work a lot of overtime. And here comes the ambulance giving us work, about to go in, so about to be fun. But anyways, so in the night shift versus day shift, the law enforcement situation is kind of different. So there's kind of like 3 different reasons that we will kind of dabble with law enforcement. I'll give you the most severe and then we'll kind of dwindle down. So during night shift, when we'll involve law enforcement is if there's like a gunshot, or someone was drunk driving, or someone got into an altercation. Those are someone is on drugs or under custody and stuff. So usually those are kind of the situations we're in. And then occasionally they'll be on the floor because they have a convict up there. Or sometimes someone in the jail place will get hurt and they'll bring the convict into the hospital to get checked out. Depending on what's going on with the patient, the police sometimes can be kind of pushy and kind of like in your way. I know they're there trying to get, like, let's say for instance, there's a gunshot, right? And the patient, like say, got shot in their humerus. We're trying to slowly make our way amongst the nurses, amongst the doctors, amongst everyone, our way to get the x-ray. Sometimes the doctor will be like, hey, yo, move and let x-ray do their thing so we can see. So they'll kind of clear a path out. But usually the police officer will be literally right next to the patient trying to interrogate him and get all the details because I know that's his job and whatever. And homeboy will be filled with drugs, maybe dying or not dying, and they'll just be like out of it and just getting interrogated. And sometimes I'd be feeling bad. Sometimes I'm like, bro, can you like back off this poor dude? We're trying to make him feel better once he gets stable. Sometimes if it's real severe, the doctor will come in and like tell the officer, hey, yo, let me stabilize this man. He's pretty bad. And then you can talk to him. Or sometimes, I guess it depends who's the officer, because certain ones are more usually it's the same officers that kind of come in. So you can kind of tell if it's going to be one of those who's like really needy and greedy, and other ones who are more chill and laid back. Because sometimes we'll be shooting them, and we're like, yo, we're going to shoot. It's going to be radiation. Either you move back or you don't, because like the doctor wants us to do it. Sometimes they care, sometimes they don't. But the problem is, like, as soon as they'll shoot it, they'll like come right next to the portable and start asking us questions. Like, yo, is it broken? How long is it going to take? Like, they'll ask you a bunch of questions, which I understand it's their job and whatever. But like, sometimes I'm like, yo, I'm just trying to, get the x-ray and show the doctor because that's who matters. Like, you're not going to do anything regardless if it's broken or not. Like, you're not going to help this dude. You're just like, my job is, take the pictures and let the doctor know what's going on. So, like, sometimes I'll just be like, yo, let me just do my stuff. Sometimes they get offended. Sometimes they're like, oh, okay, yeah, sorry, I was just being nosy or whatever. Or sometimes they take a picture and they'll document and stuff, and they'll be taking their own pictures or whatever. So that's like the most higher, like, interactive situation that happens. Other times they'll come in and they'll be like a DWI or whatever. They'll crash. So they'll have like nurses doing blood work, and we'll just do a basic chest x-ray to evaluate the patient, but the person, and then the police officer will kind of take them off, whatever. Other times, like when they're bringing in convicts, they'll be there with a little chain. They'll be in the room. We kind of let them know, both of them, both the patient and the police officer, what's going on. Usually they'll stop out. Sometimes, depending on, I guess, what said patient, or if they're more aggressive, sometimes they'll stay in there and just observe us to make sure, the patient doesn't do anything to us. And then sometimes we'll tell them and they'll stay there because they have to, because maybe that said inmate is notorious for escaping, or I don't know what's going on. They'll just stay there. And we're like, just put on some lead. It makes us feel better as the techs. And then the other situation is when we go do morning portables, they'll be on the floor with maybe like the convict or whoever is in custody, and they'll just be chilling next to them. Usually by then they're pretty chill. They're just chilling there to make sure that homeboy doesn't escape or do anything. So usually they'll just tell them, hey, we're here to get a morning port, chest X-ray or whatever. They'll kind of like move back, and they already know the little spiel because it's usually the same people. So those are usually all the times we get involved with not really involved, but they'll be in our area doing stuff. And yeah, it's been your boy Miguel. See you on the next one.